to another video. Today we're going to be talking about something that is quite important, that I believe for the United States and for the whole world actually. The United States has a lot of issues with healthcare that I've talked about on this channel already. And the way that the debate is going, it's a very shallow discussion. And why is that the case? Because I don't believe that there are two sides going at it. We don't have a structured formal debate where two sides have a chance to articulate their views and to express why one is better than the other. And in the Democratic presidential debates and discussions that they're having at the moment, it seems to me that the debate is very shallow once again because they generally all agree. They all agree that there should be some form of government healthcare system for the United States. Now, I want to remind those listening, if there are anyone out there listening to this particular video, to consider what is at stake at the moment. The United States does have issues with healthcare. Donald Trump even told Prime Minister at the time, Malcolm Turnbull of Australia, that he had better healthcare insurance in Australia than the United States did. Now, there are two different systems at play there, and the United States does have issues with healthcare. But the question that we have to ask ourselves is, what is the best way forward to fix that problem, to sort it out? The Democrats have come up with a plan. They've said, look at the United Kingdom, look at Australia, look what they are doing. Let's do what they are doing. It seems to work over there. It'll work for us here. And I don't think it is that simple. There are a number of things that the United States can do that I've articulated already to improve the system. There are a number of things at play already that are leading to reduced costs for people in the United States. So I want to do a bit of a breakdown of some of the basic arguments of the Democrats mainly, and their argument for Medicare for all through some kind of government mechanism or government system where everyone pays the government and then the government pays for health insurance for everybody. So I'm going to begin with Bernie Sanders, who's been one of the staunch advocates for Medicare for all for quite a while now. So let's look at some of his arguments and break them down and see if we can make sense of them.
Moving to healthcare, an issue that voters tell us every day is still the number one priority for them. Senator Sanders, you've spent plenty of time discussing and defending the merits of your Medicare for All plan, but the reality is that if Republicans retain control of the U.S. Senate, or even if Democrats win back a narrow Senate majority, your plan as constituted probably would not have the votes to pass Congress. So the question, Senator, is if Congress rejects your plan and the American people are looking to you for leadership on this issue, are there smaller, specific measures that you would take immediately to expand coverage and decrease costs as president?
Well, Tim, at a time when we're spending twice as much per capita on healthcare as any other nation, when 87 million people are uninsured or underinsured, when 30,000 people are dying each year because they don't get to a doctor when they should, and when 500,000 people are going bankrupt because of the dysfunctional and cruel system that we currently have, you know what? I think we will pass a Medicare for all single-payer system, and I will introduce that legislation in my first week in office. Now, to answer your question, I think when we go out to the American people and tell them that right now we have got to take on the greed and corruption of the pharmaceutical industry, for example, which in some cases charges us 10 times more for the same exact drug as is charged in this country. When the American people understand that Medicare for all expands Medicare to cover home health care, dental care, eyeglasses, and hearing aids, and does it at a cost far, far lower than what some of my opponents are talking about, you know what? We're going to have the American people behind us. We will have Congress behind us.
Thank you, Senator Sanders. Moving to health.
Okay, so that's the rather bleak picture that is painted by Bernie Sanders of our situation at the moment. And there are many issues that need to be addressed. But the question is, do we need to move to a single-payer system? And I don't think we need to at this point. The main arguments are that insurance companies, pharmaceutical companies are greedy, hospitals and doctors are greedy, and they're taking all this money at the expense of other people. That's one argument. The other argument there is that people are going bankrupt, which we'll explore a bit later because of healthcare costs are too high. Millions of people being uninsured or underinsured. I think that's not quite accurate based on the statistics that I've seen. The stats that I've seen put 91.2% of the population is having healthcare in the United States. We're talking about delivering 10% or 9% healthcare to people who don't have it. And we need to remember that not all people are without health insurance because they are destitute or can't pay for it. A lot of people choose to go without and take the risk. And we'll talk about that a bit later as well. So here's another issue that I want to explore. When asked about care for undocumented migrants, the Democrats were very quick to raise their hand.
This is a show of hands question, and hold them up for a moment so people can see. Raise your hand if your government plan would provide coverage for undocumented immigrants. Okay, let me start with you, Mayor Buttigieg. Why? Mayor Buttigieg, why?
Because our country is healthier when everybody is healthier. And remember, we're talking about something people are given a chance to buy into. In the same way that there are undocumented immigrants in my community who they pay sales taxes, they pay property taxes directly or indirectly. This is not about a handout. This is an insurance program.
You cannot let, as the mayor said, you cannot let people who are sick, no matter where they come from, no matter what their status, go uncovered. You can't do that. It's just going to be taken care of, period. You have to. It's a humane thing to do. But here's the deal. The deal is that he's right about three things. Number one, they, in fact, contribute to the well-being of the country, but they also, for example, they've increased the lifespan of Social Security because they have a job, they're paying a Social Security tax. That's what they're doing. It's increased the lifespan. They would do the same thing in terms of reducing the overall cost of health care by them being able to be treated and not wait till they're in extremis.
The first thing we have to do is recognize the humanitarian crisis on the border for what it is. We make sure that there are the sufficient facilities in place so that women and children are not separated from their families, the children are with their families. We have to make sure that ICE is completely reformed and they begin looking at their job in a humanitarian way where they're addressing the whole needs of the people that they are engaged with along the border. And we have to make sure ultimately that we provide not just shelter, but food, clothing, and access to medical care.
Okay, if it is a discussion and a debate about costs in the United States, how in the world will offering free health care to those who are undocumented, those who are not citizens of the United States, health care? We can't have both of these things. And there has to be some distinction between who is a citizen and who is not a citizen. There should be benefits and rights that go towards people who are citizens that don't go to those who are permanent residents or those who are migrants, for example. And it's no different in places like Australia. There are certain benefits that don't go to those who are permanent residents. There is a clear distinction between what a citizen can get versus what a permanent resident, someone who's there legally, versus someone who is there illegally. There has to be a distinction there. And if it's about cost, there's no way that undocumented migrants will lead to lower costs or some kind of better outcome in the United States. It will only serve to draw more migrants in as benefits for them go up. And it's a contradictory message that we're sending at the same time, particularly from President Trump, who's trying to limit the amount of people who are coming illegally to the United States. And I think this measure by the Democrats would only serve to increase that amount of people coming across, which would only serve to increase the amount we're paying total on healthcare in the United States. So this is a very questionable thing that I hope people really think about when they go to the ballot box and consider what the Democrats have planned for healthcare in the United States, that it's not just for citizens, that it's opened up to everyone who is in there. Anyone who needs care can get it. And I've argued before that with the laws in the United States, no one can be turned away as it is right now. If you come into the hospital for a medical emergency, you will be supported under the acts and the legislation that has been introduced. I'm not sure what it's called off the top of my head, but it's the act that makes it illegal for a hospital to turn anyone away for coverage. So people do get coverage, whether they're a citizen or not already. But opening up this to undocumented migrants is not a good path to go down. Let's look at the next one.
With Warren in the spin room.
Like the things that touch their lives every single day. 2020 is not just about determining the direction of this country for 4 years or 8 years. It's about generations to come. And we need to say as Democrats that we get it. And here's our vision for how we're going to.
Senator, on the question of costs for Medicare for all, you were asked about whether or not people's middle-class taxes would go up. You said their costs would go down. But can you address directly whether taxes like mine would go up under Medicare for all?
I'll say it again. Costs are going to go up for billionaires. They're going to go up for giant corporations. And out-of-pocket costs for middle-class families are going to go down. It's costs that matter. You know, keep in mind, I'm somebody who spent a big chunk of my life studying why people go broke. And a huge portion of those people go broke because of health care costs, and those are people who have health insurance. I talked tonight about Addie Barkin, somebody with really first-rate good health insurance, who still, month after month, has to spend about $9,000 to get the medical treatment his doctors and nurses say he needs. His wife spends hours on the phone begging the insurance company to cover him. And that's not what insurance companies are about. They're about taking in the most money that they can and paying out the least. We can't sustain a system like that. It sucked $23 billion in profits out last year. We just
So this we have a bit of an attack on the insurance companies, how they're all about greed, etc., etc. But she fails to recognize that there are many options in relation to health insurance. There aren't enough, I agree. There aren't enough options, and there's not enough competition in the health insurance market in the United States. But she fails to ignore that there are a number of non-profit health insurance companies in the United States. So there is a diversity of companies, some that are for-profit, some that are non-for-profit. And I think, she only has a few minutes to speak each time, and she pumps in the emotional argument about how destitute people are and how broke people are going. And I sympathize with that. But to use that as justification for some kind of Medicare for all does not address the issue of why these people are paying so much in the first place. All that it's going to do is take control of all these industries, of the prices of all these services, what doctors are paid, what services will be charged for whatever amount that they decide. And these arguments may sound appealing to people, the emotional argument, but we have to dig a little bit deeper. Greedy health insurance providers isn't the only reason healthcare is so expensive. And I'd argue that they're not as corrupt or as, anything like that, as I would say. So Elizabeth Warren says that she has a lot of experience researching and studying why people go broke. And I get that. She's published a number of papers that have talked about, health insurance being one of the reasons that people go bankrupt. But there's a number of articles out there that have challenged her views, challenged the idea that it's, hard to pinpoint. They've said that it's hard to pinpoint why a person goes bankrupt because there's so many reasons why it can happen. And this paper is interesting as well. Neil Mahoney talking about bankruptcy as implicit health insurance. So this article here, it's some 62 pages. It talks about how some people can use bankruptcy as a way to mitigate the risk. As an example, a person might look at the cost of healthcare, maybe $200, $300 a month. They'll look at that and they'll say to themselves, what is my risk profile? How likely am I to get injured or to get sick? And some weigh it up and decide for themselves that, no, I'm not going to do it. I'm not going to pay for health insurance. And this is one thing that the Affordable Care Act tried to do. It tried to force people to take out health insurance, which has been deemed unconstitutional in the United States. So Neil Mahoney explores the idea of bankruptcy as implicit health insurance, basically meaning that rather than pay for insurance up front, if someone has a catastrophic incident, which happens on occasion, but for many people, it won't happen. So they take the risk, but they use bankruptcy as a way of getting out of paying for the bills, a way of, receiving coverage by not having to pay for any form of insurance. They go bankrupt. And I've seen some cases where you can actually negotiate a better price through the bankruptcy process with, say, a hospital or with some other person that you owe money. You can negotiate with them in a way to reduce your actual costs that you'll pay out of pocket, perhaps to avoid bankruptcy. So I highly recommend reading this article just to get some balance on the idea and some more coverage and different perspectives on bankruptcy in the United States, bankruptcy and medical care. So moving on now to Kamala Harris.
Senator, in
Real
our lifetime,
people.
cures for all.
And the reality of how this affects real people is captured in a story that many of us heard, and I will paraphrase. There is, any night in America, a parent who's seeing that their child has a temperature that is out of control, calls 911, what should I do? And they say, take the child to the emergency room. And so they get in their car, and they drive, and they're sitting in the parking lot outside of the emergency room, looking at those sliding glass doors while they have the hand on the forehead of their child, knowing that if they walk through those sliding glass doors, even though they have insurance, they will be out a $5,000 deductible when they walk through those doors. That's what insurance companies are doing in America today.
We're going to continue this discussion. I wanted to put it in.
So we have more arguments against the health insurance companies about how corrupt they are, about how greedy they are, and how you have a $5,000 deductible just for going to the hospital. Now, I don't have any evidence to back up that claim. I'd love to hear if anyone here has had that experience. But once again, it's the emotional argument about particular incidents of people doing it rough and having a hard time. And I'd love to know if that's a reflection of the wider scheme or picture of healthcare in the United States. Is it truly that bleak? I don't know. To be honest, I'll have to do some more research. But I don't think it's as bad as they make it out to be. Okay, so moving on. We've talked about healthcare in the United States, why it costs so much more, and this has been the justification for moving to a single-payer system. And my argument basically against it is if the government takes over the industry, they will have to exert too much control over it. So we have to look at why it costs the U.S. so much more to deliver health care and answer the question why the health outcomes aren't the same in the United States as other parts of the world. And it's not as simple as greedy health insurance companies. It's not as simple as greedy doctors. There's more to the story here. So let's look at some of them. Administration costs. About 25% of the U.S. healthcare costs relate to administrative cost. So that is an issue in relation to insurance companies having to file paperwork, getting services paid for basically through a secondary party rather than paying for it directly, and all the costs associated with that. Cost variations across hospital regions, so different hospitals costing more, charging more than others. That has been addressed by trying to make the prices more transparent so people can shop around for the best price, encouraging more competition from the hospitals. The U.S. spends more than other countries for the same things. That's true. I imagine there are different negotiations for different prices, and in many other countries, the government negotiates the prices and actually sets them. And your only way to actually get into the market is through the government. There's no other way to get in, so companies are basically forced to accept whatever the government is willing to pay. So here's where it gets interesting. It's almost as though the wealth of the United States works against itself in relation to healthcare. higher level of per capita income, which is correlated with higher healthcare spending in the United States and other countries. So basically, people have more money to work with. People have more money to spend than in other countries. And when they do, they spend it on healthcare. And I thought of the example, when you go to a hospital in the United States, there are different options. And if you think about it, rather than just everyone having the same coverage, the same care, in the US, you have options. If you want to have a private room, you can. If you want to have better food, you can get better food. If you want to have more coverage, more health care, if you want to spend more on it, you can. And people have more money to spend on it. Americans receive more medical care than people in other countries. This is another thing that people don't talk about. The US consumes 3 times as many mammograms, 2.5 times the number of MRI scans, and 31% more C-sections per capita than peer countries. So these are a number of reasons why it's going to cost people more in the United States for coverage, because they consume more than other countries. No one talks about this stuff when talking about costs. All they do is talk about health insurance. All they talk about is greedy health insurers, etc. And lastly here, the US government intervenes less actively to force down prices in the United States compared to other countries. So the government has less control over what happens. And I must say that has to be a good thing. Because when the governments try to impose price controls or wage controls, it's not a reflection of the reality of the market, which is dictated oftentimes by the availability of labor, the availability of people to do the jobs. And that's the argument that goes into why there's more, wait times for people to get elective surgery and things like that in countries that are single payer or government-based systems. So these are things that we have to take into consider when we're talking about healthcare in the United States. But the discussion is very, very shallow at the moment, and I hope that people will explore a bit deeper some of these ideas, do some reading, and look behind the emotional arguments that are coming from the Democrats about why we should move to a single-payer system. And I think the only thing that will happen if we do that is it will not address the issue of high-cost healthcare in the United States. It will simply continue to pump more money into an inefficient system that can be improved in a number of ways, but we can't capitalize on that if we're not having the discussions about that. If the consumer is not educated, they cannot make decisions that are going to save them money. And we need companies to compete. We need hospitals and insurance companies to compete, and there's other issues like the health of the United States. I asked a friend recently who was making the case against the U.S. healthcare system. I made the case about the opioid crisis. I'm not sure of any other country in a single-payer system that has what we call an opioid crisis like we do have in the United States. How about the cost of gun violence in the United States? The cost of lifestyle? Obesity, drinking, smoking, etc. These are things that aren't talked about. And I think we need to have a more thorough discussion about healthcare in the United States that will lead us to a solution that is pioneered by the United States to show that it is possible to deliver healthcare to a people, healthcare services to people at an affordable rate that is accessible and affordable. I believe it's possible if we have the right discussions. But right now, it's far too shallow. It's not as in-depth as it should be. So let's have the conversation here. Let's talk about it. What do you know? What do you see? If we find solutions, we can have better healthcare in the United States. Let me know what you think.